Good morning, everyone. I'm Alfred Atanda, and welcome to my YouTube channel, Alfred Atanda MD. Today, we'd like to talk about kind of a difficult topic we see a lot in orthopedic surgery and sports medicine. It's all about how to embrace and understand the concept of the mind-body connection. Now, in sports medicine, we see a lot of kids and young adults with joint pain, knee pain most commonly, sometimes back pain, elbow pain, shoulder pain. And by and large, most of the time, we can figure out specifically what the diagnosis is, and we can find an orthopedic cause for the pain. But being in this practice for the last 8 years, I've learned a lot in seeing a lot of patients, in the sense that sometimes we don't always know exactly why people have the pain that they have, specifically from an orthopedic perspective. Um, we are taught and trained to believe that, with enough imaging and investigation and counseling, you can always get to the source of somebody's pain and problems. But what I've learned in the last few years is that's not always the case. There's probably about 10% of the kids that we see in our clinic who have, substantiated real joint pain and muscle pain, bone pain, but it's not necessarily from an orthopedic cause. And by leaning on some of my psychology colleagues, I've actually learned a great deal about the mind-body connection. It's very powerful when people have different psychosocial stressors in their lives. And it can take a toll on their body, and that's very well established and researched. And how it takes a toll on your body is really going to dictate the route you go to seek care for that problem. And usually it manifests as pain, and it can result from an actual injury, or you may not have had an injury at all and you just started noticing joint pain. And if it is indeed joint or bone pain, oftentimes the kids find themselves in an orthopedic office, especially if they play sports. But if you have constant headaches, you may find that you're seeing a neurologist. If you have belly pain or stomach pain, you may be seeing a gastroenterologist, and so on and so forth. And one of the things that you do have to understand is that you may not even realize what some of these psychosocial stressors in your life are doing to your body, let alone that you're even affected by them. A prime example is oftentimes, when we do have these discussions in the clinic, we ask the child, how is everything? How's life? How's school? How's your family? And pretty much they always say fine. But when we have them interact with trained specialists in our psychology department, there's always a lot of extra information that they can glean from the situation that can shed some light on what's going on. So if you have a child, an athlete or not, who is having not just joint pain or musculoskeletal pain, but some kind of unexplained pain, if you've gone through the usual motions of rest, activity modification, physical therapy, you've gotten x-rays, MRIs, you've gotten blood work, sometimes if that's all normal, it's very reasonable to take a step back and try to see, well, is this pain coming from the specific body part that's painful, or is it something else? And that's a very, very hard discussion to have with your child and even with yourself, because we're trained in human nature to always think that there's a discrete, anatomical, tangible source for the pain that we may be feeling and experiencing. But in my experience, I've realized that that's not always the case. And I think you should always do your due diligence and really try to find the source of the pain. But if you find yourself seeing multiple doctors and multiple specialists and having all sorts of tests, and nobody can find anything wrong with your child, it is helpful sometimes to think about that mind-body connection. Because in today's day and age, let's face it, being a child is very hard. Kids struggle with a lot of anxiety, a lot of depression, bullying at school, divorce of parents, death of a family member. There's all sorts of things that happen in their daily lives that may be impacting them in a negative way, and they themselves may not even realize it. And I think at least exploring the possibility that it could be not that they're making the pain up, I would never say that, but it could be some stressors in their lives that are manifesting as pain, not necessarily as a discrete, tangible, anatomic thing. Because we've made the mistake sometimes of assuming that, oh, well, my child has had knee pain for however long, so there must be something wrong. So let's do a diagnostic arthroscopy or some sort of surgical procedure to get inside there and look around. And in those situations, we invariably don't find anything. And now the patient has had anesthesia, they've had the risks of surgery subjected to them, and that's not really going to help them, specifically if their pain is still there. So I think, my main advice for parents is to really be open-minded, to really be able to have a tough and courageous conversation with your child, and even understand things for your own sanity, that this could be a real thing that's affecting your kid. And sometimes parents who deal with, certain psychosocial stressors in their lives have kids that have similar problems. Not necessarily because it's genetic, but sometimes kids feed off of the issues that we have. And sometimes, unbeknownst to us, some of our own struggles with these things then get transferred to our kids, because our kids are very perceptive and they pick up on these things. And that's something to always consider. And when I have these discussions in the office, it's usually very tough and it's hard. And as a surgeon, I try to be in and out, see people, get to the root of the problem, and move on. But I think over the years, I've realized that in these particular situations, sometimes it does require a lot of extra time. And I think you all as parents out there sometimes can be frustrated because you may go see a surgeon and you may feel dismissed, or you may feel that they're not listening to you or your child's issue. So I think, looking for someone that will listen is definitely something that's very helpful. And also understand that, if you are dealing and struggling with chronic pain and you haven't found a quote-unquote answer and you're not sure where to go, just realize that you're not alone. There are a lot of people out there that have similar issues and that are going through the same thing. And you're not crazy. You're not making this up. That's not anything that I would ever suggest. But I think taking a different look and having a different viewpoint on your symptoms and what you may be going through, and at least entertaining the idea that it could be something not necessarily organic and orthopedic, but it could be, part of that mind-body connection and the continuum of how the things that happen to you affect your body, that could definitely be something that's real. And I think once you grasp that and at least entertain the idea, that's really the first step in feeling better and having some of your symptoms alleviated. Now, I'm not saying that's always the case, and I'm not saying that's always the answer, but it's a possible answer. And I think when you're desperate and you're really looking for answers, it's something to consider. So again, realize that the mind-body connection is real. The things that happen to us in life definitely infect us in ways that we may or may not totally understand. Psychosocial stressors and different problems that arise in our lives can definitely manifest as pain in various body parts. And if you find yourself seeing lots of doctors, getting lots of tests, not getting answers, getting multiple opinions, feeling that no one can quote-unquote figure out what's wrong with your child, just always remember that, looking into how the mind and the body are connected could potentially be the answer that you're looking for. So good luck. Thanks for listening. Please subscribe to my channel, Alfred Atanda MD, on YouTube, and stay tuned for more exciting topics in sports medicine, orthopedic surgery, and digital health innovation. Have a great day.